So today I am taking up a very important intra-abdominal organ, and that's the liver. Okay. Now I will be taking you through the liver as far as its surgical anatomy is concerned, the various important things which are associated with the liver, which are important for you from a clinical viewpoint, MBBS viewpoint, NEET PG viewpoint, as well as from medico-surgical viewpoint. Okay? Now, first of all, about any organ, you have to remember the dimensions of the organ, okay? The weight, wherever applicable. So as far as liver is concerned, first of all, I have told you about the quadrants of the abdomen, isn't it? We divide the abdomen into 9 quadrants, and where does the liver lie, okay? So as far as the liver is concerned, so you can see that the liver occupies usually a major part of the right hypochondrial area, a small part of the left hypochondrial area, a part of the epigastric area, and the umbilical area. Now, because the liver is a large organ, it spans across a bit of a major portion of the abdomen, isn't it? So, for a layman, we can say the liver lies within the right upper quadrant predominantly, okay? Now, that is one part. Number second is the texture, the color of the liver. The liver is usually soft, okay? Why it matters, I will be telling it at a later point of time. Then third point is the color. It's usually reddish brown in color, okay? That you already know. Now, as far as the liver is concerned, its weight ranges from an adult, I'm saying, from 1.2 to 1.6 kgs. That's important. Now, as far as the liver is concerned, we have got this important thing, organomegaly, say hepatomegaly. Normally, I would tell you, especially the right subcostal margin, okay? The liver should not be palpable in an adult below the subcostal margin, as simple as that. So we have the subcostal margin over here. The liver normally should not be palpable below the subcostal margin. So that is one part. Now, just once we have a look at the liver, we do the dissection, we open the abdomen, we would come across the anterior surface of the liver, okay? And this is how a typical liver would look like. So as far as the color I told you, it's already reddish brown, okay? Then we have got the thoracic cavity and the abdominal cavity, okay? The thoracic cavity and the abdominal cavity separated by the diaphragm, okay? At certain place important is that below the diaphragm, I showed you the right hemidiaphragm and the left hemidiaphragm last time, and the right hemidiaphragm is pushed a bit higher because of the right lobe of the liver, okay? So that's important. Then what is important is that beneath the liver lies a space which we give the name as subdiaphragmatic space. So on the right side, we have below the diaphragm space, which is given the name as, so it is a space beneath the diaphragm, and what lies? The right lobe of the liver, okay? The superior surface of the liver and the inferior surface of the diaphragm, that comprises the subdiaphragmatic space on the right side. That's very important. Is it fine? So this is something about it. Now, once you have a look at the liver, on the anterior aspect, you will see simply, over here there is a ligament, and that ligament is given the name as falciform ligament, okay? So we have got the falciform ligament, which you see on the anterior surface of the liver. So this is the falciform ligament, okay? And important is that structurally, it distinguishes the liver into 2 lobes, a predominantly larger lobe, which is the right lobe of the liver, and a smaller lobe, which is the left. So this would be the, So this would be the predominant right lobe of the liver, and this would be the predominantly smaller left lobe of the liver. And this is a ligament, which is the falciform ligament, which we see anteriorly. Clear? Then, beneath we see a small projection. which would just like to, it would look as if it is a continuation of the back, but it is the round ligament or the ligamentum teres. Now, this is not the ligamentum teres of the femur, that is ligamentum teres femoricus. This is ligamentum teres hepaticus. Very, very important. So, this is the round ligament of the liver or the ligamentum teres of liver, ligamentum teres hepaticus. That's important. Then, going back to the slide, what I showed you. Now, over here. So, this is the right lobe, this is the left lobe. Now you can see over here, there is a ligament which is just present anterior-superiorly. We give it the name as coronary ligament. Though this is liver, coronary would refer something to the heart. So we have got a ligament which is present on the right side, which is present on the left side, and we give it the name as coronary ligament. Okay, that's important. Then also we have got over here the left triangular ligament and the right triangular ligament. Now you tell me, sir, what is the right triangular ligament and what is the left triangular ligament? Fine. What happens, the coronary ligament has got an upper layer and the coronary ligament has got a lower layer. Okay? The coronary ligament has got an upper layer, the coronary ligament has got a lower layer. The point where they fuse, it forms sort of a triangle. So that is what we give the name as what the superior and the inferior layers of the coronary ligament on the right side and the left side meet. That point we give the name as triangular ligament. On the right side, right triangular ligament. On the left side, left triangular ligament. Got it? Any confusion? So these are some of the important ligaments in connection. This is a very important question asked from you. Okay? So the coronary ligaments, the triangular ligaments, the ligamentum teres, and the falciform ligament. Is it clear? So now, this is the anterior surface of the liver. Then we have a right lateral surface. So this would be the right lateral surface of the liver. Then we have the superior surface of the liver, which abuts the diaphragm. And then we have a posterior and an inferior surface of the liver. Got it? So we have got 5 surfaces of the liver. The one you see over here is anterior. The one which lies towards the right is the right lateral. And we have the superior. And posteriorly, we have the posterior. And then we have a bit of an inferior surface. There is no left surface of the liver. Got it? So that's important. So this is something about the liver anatomy as far as things are concerned. Now, as far as you see, this is the anterior view of the liver, and this is the falciform ligament, the right lobe and the left lobe. Now over here, we have got this thing, and this represents the posterior view of the liver. And this posterior surface of the liver is also given the name as visceral surface. Okay. Now, but important thing is that we have just said that the liver has predominantly 2 lobes. That is the right lobe and the left lobe. But posteriorly, we have 2 other lobes. Very, very important. And these 2 lobes are the caudate lobe and the quadrate lobe. So over here you can see, this is the caudate lobe and this is the quadrate lobe. The name, caudate means tail, and the quadrate means quadrilateral, isn't it? So like that. So the caudate lobe and the quadrate. So now we have got in addition to the right and the left lobe. How many lobes? 2 more. One is the caudate lobe and other is the quadrate lobe. So the liver as such has got 4 lobes. Right, left, caudate and quadrate lobe. So remember that thing. Now, as far as the ligaments are concerned, we classify the ligaments of the liver into 2 categories. The pseudo-ligaments or the false ligaments and the true ligaments. As far as the true ligaments are concerned, we have got the round ligament of the liver and the ligamentum venosum. Okay? Ligamentum venosum, I will be showing you what it is. So, we have got the true ligaments. Only 2 ligaments of the liver are true. One is the round ligament of the liver and second is the ligamentum venosum. All the other ligaments which are attached to the liver are pseudo or false ligaments. I will be coming to lesser momentum. You know that we have studied it previously. Falciform ligament, the coronary ligament, and the triangular ligaments. Now, as far as the ligamentum venosum is concerned, this is the ligamentum venosum. Okay, so this is the ligamentum venosum, which is present on the posterior surface. Okay, and the ligamentum teres is also seen as a projection over here. Now, this is what I was mentioning, the left triangular ligament. It is topsical. So, and this is the upper layer of the coronary ligament, and this is the point, which is the right triangular ligament. What it? Now, see what's important. At some places, the diaphragm lies in relation to the liver, but at some points, so we have got the peritoneum associated. So liver has got peritoneal association as well. But some areas of the liver, they do not have the peritoneum covered over them. And those areas are given the name as bare areas of liver. So, all the areas of the liver which are not covered by the peritoneum. So the areas of the liver not covered by the peritoneum are given the name as bare areas of liver. And we will be coming across the bare areas of liver as well. So important is that you have to remember that the bare areas of liver are the areas where the liver is not covered by the peritoneum. That's very, very important. Now, as far as so again, this is an enlarged view of the ligamentum venosum and the ligamentum teres. Now, once we have the anterior surface, once we do the dissection of the liver, so what will we have anteriorly? The anterior abdominal wall, isn't it? I have told you, then we have the superficial fascia, isn't it? Then afterwards we go interior, where the muscles and all those things, the extraperitoneal connective tissue, the peritoneum, and then we breach the peritoneum, we enter, and so we will be having the liver surface anteriorly. Now, posteriorly, what's important is that the posterior surface of the liver is also given the name as visceral surface, because anatomically there are many viscera which are attached to the liver on the posterior surface. So as you can see over here, there is this area over here, and you remember that this area on the posterior surface of the liver represents the esophageal area. So we have an impression, I need to say the esophagus, this is the esophagus. Then we have an area over here, this is the gastric area. So this is important, okay? Number 2, esophageal area, gastric area. Then over here, we have got the caudate lobe, this is the caudate lobe as we previously mentioned, and this is the colic area. Okay, colon is attached here. Then we have the duodenal area. Then we have the renal area. And top of the kidney we have the suprarenal area. And this is the bare area because it is not covered by peritoneum. What it? So you can see anti-clockwise: esophagus, stomach, colon, duodenum, kidney, or you can see esophagus, stomach, part of small intestine, part of large intestine, kidney, suprarenal, and the bare area. So it is simple. The flow of the gastrointestinal tract, isn't it? We start with the esophagus, we go to stomach, we go to small intestine, we go to large intestine, we go to kidneys, we go to suprarenal. So it is anti-clockwise, very simple to remember. There is nothing cramming about it. So this is because sometimes the question is asked, image-based question. Just write a short note in the label diagram on the relations on the anterior posterior surface of kidney, the relations on the liver. So these are diagrammatic type of questions which are asked from you. Okay, simply here you might not have to write something, just a figure of these things. So this is how we represent that. I mean to say the visceral surface. Now this is an important vessel, and this is the inferior vena cava. On the posterior surface of the liver, we have got a very important vessel, the inferior vena cava over here. Okay. Now, what we have got got these organs, whether this is the lung or whether it is the liver, and each organ has got a hilum through which the structures enter and leave the organ, isn't it? And that we give the name as hilum. So as far as the hilum is concerned, we have structures, and what enters the liver? So we'll be coming to that. So we have an arterial component, a venous component, and especially in case of the biliary system, a biliary component, isn't it? So we have got the hepatic artery, the portal vein, and the bile ducts. They are very important. And as far as the hilum of the liver is concerned, we give it the name as porta hepatis. So the hilum of the liver is given the name as porta hepatis. Got it? Are you seeing it? So in it, we have got the relations that we have got the portal vein, the hepatic artery, and the duct, VAD, okay, from posterior to anterior, okay. So the structures from posterior to anterior in that manner, or from anterior to posterior, are duct, artery, and the vein. That is very important, isn't it? DAV, from anterior to posterior. By hepatic duct, hepatic artery, portal vein. So the arrangement of the structures at the porta hepatis, you have to remember. Now, I did not miss one point, and I told you at the onset that there is one important ligament which is not a true ligament, lesser omentum. And once we were doing stomach, I told you the lesser omentum arises from the lesser curvature of the stomach, and here it arises from that place, and at that point of time, I told you it just goes in relation to the liver. And what part of liver? The margins of the porta hepatis. So lesser omentum would be where? Present around. I told you that we have got this. The lesser omentum is also given the name as hepatogastric ligament. Why? Because now we can understand it over here. I did not emphasize it at that point of time. The lesser omentum is also given the name as hepatogastric ligament. And to be more specific, hepato, from what part of liver? The margins of the porta hepatis. To what part of stomach? The lesser curvature of the stomach. Are you getting it? Right or wrong? And then I told you further that it has got another part, hepatoduodenal. A small portion of the lesser omentum also goes in relation to the duodenum. So lesser omentum is a combination of hepatogastric and hepatoduodenal ligament. So but where from the liver it arises? From the margins of the porta hepatis. That is what is demonstrated over here. Okay? So this is porta hepatis, very important. Now, going back to this diagram. Now, this is the which lobe? And this is the quadrate. Now you can see the quadrate lobe. The quadrate lobe is this one, and this is a very important, I would say, organ which is associated with the liver as well. And this is the gallbladder. And the gallbladder lies in the liver in a fossa, which is given the name as cystic fossa. Okay, so if we just remove the gallbladder, beneath the gallbladder there will be a sort of a depression, a cavity, and that cavity is given the name as cystic fossa. So you can see the relation of the gallbladder in relation to the liver. So the liver encloses the gallbladder as over here. Okay, so this is the gallbladder, and this here you can see. Now this is the quadrate lobe, and this is the porta hepatis. So the quadrate lobe is bound by the porta hepatis superiorly, the cystic fossa on the side, and here this is the inferior border of the liver. So this is the quadrate lobe, and this is the quadrate lobe. And you can see a tail-like process, and this is given the name as quadrate process. Got it? So you have got some terminology associated with the liver, okay? So these are some of the important components of the liver which you see as far as the anatomy of the liver are concerned. You have to remember all these things in a sequential manner. The first thing, the consistency of the liver. Now, as far as the consistency of the liver is concerned, I mentioned it is usually soft, but that softness may sometimes be altered, because now we have all those fibroscans and all those things which we do. Why do we do? Because the normal architecture of the liver gets changed, especially in case of diseases where we have fatty deposition within the liver, and we call it fatty liver, quite a common entity these days. Every third or fourth person has got this problem, I mean fatty liver. So in fatty liver, the consistency of the liver changes, and that is detected by the fibroscans. So that's very important to know the consistency. Now, we again have got, especially those who take alcohol, and a lot of alcohol, chronic alcoholism, that causes a typical, I mean to say, problem with the liver, which is given the name as liver cirrhosis. So cirrhosis of the liver, what happens within the cirrhosis of the liver? We have got nodules, cirrhotic nodules, micro or macro. There are types of cirrhosis. So micronodular or macronodular cirrhosis. Okay? Micro of a lesser severity, macro of a greater severity. So in that also the consistency of the liver changes, and that is detected on scans as well as ultrasounds. That's another part. Okay? So that is about the consistency of the liver. Now, third thing, liver is a quite common site for malignancies. Very important. It is one of the most common sites for metastasis. One of the most common sites. So malignancies from the gastrointestinal tract usually go to the liver. Okay, so that's important. And in that, once there are metastatic nodules in the liver, they are, I mean, they may be nodular, and unfortunately, in late cases, you have got the hepatomegaly also associated, and you can just feel with your, I mean, say hands, the nodular consistency of the liver mets. Okay, so that's important. So what I want to convey in a nutshell is that the liver is usually soft normally, but it can undergo these changes as far as its consistency is concerned. Now, number second is the size, okay, especially the right lobe of the liver, isn't it? Now, once we go for the examination of the abdomen, okay, and then we should normally not feel the liver below the right subcostal margin, okay? But in case it is 2 fingers breadth below the subcostal margin, we give it the name as hepatomegaly. And there are many, many conditions which cause enlargement in the size of the liver, which we give the name as hepatomegaly. So that is very important. So hepatomegaly, you have to take into consideration while doing an abdominal examination. And there are so many causes of hepatomegaly. It will take one day to just describe the cause of hepatomegaly. I will not touch that topic, but here, from a surgical viewpoint, from a medical viewpoint, you have to remember hepatomegaly as one of the important conditions as far as the liver is concerned. Now, after that, we have got certain important issues as well as far as the blood supply of liver is concerned. Liver is one organ. Liver is one organ in which the predominant source of blood supply is not an artery, it is the vein. So the predominant source of blood supply to the liver is by virtue of a very important vein, which we give the name as portal vein. So portal vein carries almost 65 to 80% of the blood of the liver. Okay, so the predominant source of blood supply to the liver is by virtue of portal vein. The rest of the blood is by virtue of hepatic artery. So once an examiner asks you what's the blood supply of liver, the first thing you should mention is the portal vein, and second should be the hepatic artery. And what's important about the blood supply of the liver at a microscopic level is that the blood, we have got this artery, you just go and divide within the substance of the liver into multiple branches, then the veins, interlobar, interlobular, all those things. But important is that there are those pools of blood, which we give the name as hepatic sinusites. Very important characteristic feature of the liver on microscopic or histological examination is the presence of hepatic sinusites. So liver is one important organ in which we have got venous pools of blood, the sinusites. Okay, that's important. Now, as far as the lymphatics of the liver are concerned, we have got the hepatic group of lymph nodes which are scattered around the hilum of the liver and various other groups of lymph nodes. But as such, important in liver is the vascularity of the liver predominates than the lymphatics. In certain organs, the lymphatic drainage is more important. In other organs, the blood supply is more important. And liver is one important, organ in which the predominant source of metastasis of tumors is by virtue of the vasculature, not by virtue of the lymphatics. So that is why the liver is on the omniscient, because it has got a very good blood supply. That's important. Then another important fact about the liver is the capacity or the ability of the liver cells to replicate. If liver is damaged, we can just remove a large chunk of liver because liver is one organ which regenerates. Very important. It is unlike the neurons. The hepatocytes are unlike neurons. Neurons once gone are gone forever. But liver cells have got this tremendous capability of regeneration. That is why a liver can regrow back to the size. Okay, that's important. Now, that is from a microscopic point as well. But over here, another important fact is that we have got over here, this is something what's important nowadays. In previous days, we used to have issues in surgery. That means a surgeon had to operate. He used to remove a large portion of the lung. He used to remove a large portion of the liver. But nowadays, it is a question of segmental resection. What is that? The scientists have discovered that on the basis of branching pattern of the vasculature and the bile ducts, that like we have got in lungs, the bronchopulmonary segments, and each bronchopulmonary segment is an independent functional respiratory unit. In a similar manner, exactly in a similar manner, we have got the liver divided into segments, and each segment is an independent liver, to put it as simple as possible. And in here, we have divided the liver into many segments, and this is another one classification of division of the liver is into the right lobe and the left lobe, that is based on the ligament, isn't it? Then another classification is distinguishing the liver on the basis of 4 lobes, that is based on anterior, posterior, the ligaments, and the other structures which just divide the quadrate, right and left. But this is a recent surgical classification, not recent, a bit old, but this is the latest, because this is given the name as Coinard's segmentation of liver. In here, we divide the liver into many segments, and each segment. Now, if a surgeon has got issue with the right side of the liver, he has nothing to do with the left side, not even right side. He has got an issue just on the right inferior segment of the liver. He does not need to remove the right upper segment, because now there is the segmentation of the liver. So to get acquainted with the segmentation of the liver is divided into multiple segments. And over here, you can see this is the anterior surface. So Coinard segmentation of the liver is a 3-dimensional concept in which the liver is divided into multiple segments. And you can see anteriorly 2, 3, 4A, 4B, 5, 6, 7, 8. Now this would be the upper left lap. Okay, this would be the lower. This would be the lower left medial, and this would be the medial. So in a similar manner, this is on the anterior surface. You see these segments. So this is what is visible to you on the anterior surface. Now this shows the 3-dimensional concept of the Coinard segmentation. So this is a rotational figure, and you can just see all the segments over here. So this is the basis of Coinard segmentation of the liver. Okay. So this explains it far more clearly on the anterior and the posterior surface. So you can see that liver, again like the lung, is subdivided into multiple segments, and these are given the name as Coinard's segments of the liver. So this is another important point about the liver. So as far as the liver is concerned, you have to be well acquainted with all these points as far as the surgical anatomy of the liver is concerned. And you are asked questions on the liver, other questions other than this: what is the capsule of the liver called, and what's that, by the way, called? Gleason's capsule, isn't it? From a microanatomical, which I will not take up over here, you know the central vein, the porta triad, isn't it? The hepatic lobule, isn't it? The acinus, all these concepts, isn't it? Then the cells of the liver, the hepatocytes, the space of disease, the space of mole, isn't it? Then you are also asked about the Ito cells, you are asked about the von Kupfer cells, different things. So these are some things which are asked from you as far as the liver is concerned. Thanks.